It's helping those who cannot pay for hospital care to get care that they need free of charge, and sometimes on a sliding scale. It was brought about just to help those in low-level income. The first type of charity care started as the Hill-Burton Act of 1946. This was brought about, it was kind of like grants for nonprofit hospitals to help them help more people as they can. And then in return for that, they received a tax deduction. And then in the early 20th century, hospitals were made to require to meet certain criteria to qualify for the tax exemption. And prior to the enactment of 1969 government beneficial standards, hospitals were governed by a financial ability standard, which was specified that nonprofit hospitals must provide free or low-cost services to those that apply. So pretty much what it is, it started as a governmental grant that was given, and then it became larger. Also, that came from this was also the law that said that you cannot, if someone has like emergency use, that you cannot turn away from them from your hospital. So who is eligible? Usually limit these programs to people not eligible for governmental medical assistance or programs, those unable to pay for their medical bills, or those who have limited finances or resources. Become established for a Helping Hands program, which is what is called through Aurora. The patient must permanently reside in Wisconsin and must reside within the Aurora Healthcare geographical location. The patient must have an established relationship with the Aurora Healthcare provider. This all came from their website, so if you do want to go, if you've already been a part of the Aurora Healthcare, then it's easier to go ahead. Service may not be covered by any private or public insurance program. So again, like said earlier, you can't be under Medicaid or Medicare or all the other things that still get financial assistance options from other sources must be explored prior to receiving financial assistance. So you have to go out and at least try. So it could be as easy as you applied for one of these governmental health cares and then get a denial letter. It shows that you did go out and try and did try to get as many resources as you can. Either it being also going to a clinic and saying, well, they can't do exactly what I need done because they don't have the resources. Eligible services through Helping Hands is medically necessary services related to an illness or condition, elective or cosmetic services, or routine services do not qualify this, and it includes fertility treatment. This includes things like screenings for like mammograms and things like that. They cannot have that through charity care. This is medically necessary, which means like if you don't get this, you may not make it, type of thing. Franciscan, to be eligible for their community care, if you do not have insurance, you will automatically receive a discount or medically necessary services. You may be eligible for larger discount under the Community Care Financial Assistance Program. So Wheaton Franciscan is similar to Aurora and other hospitals, whereas if you don't have the means to get insurance, they may help you. So community care, Wheaton Franciscan, they have a little bit more as well. Medically necessary procedures may need prior authorization before scheduling some things, and that's what came from the financial counselor I talked to. Doctors and hospitals are covered through their charity care. They will help you find a primary care physician, and they will be covered if you go through the Wheaton doctors. No elective cosmetic surgeries or screenings, and no prescription services. Columbia St. Mary's. To become eligible for a charity care program through Columbia St. Mary's, you must be a patient with an income less than or equal to 200% of the federal poverty level. Will be eligible for 100% charity care write-off of the charges for services that have been provided. All patients with incomes above 200% of the FPL, but do not exceed 300% of the FPL, will be eligible for discount on services providing to them based on a sliding scale. So this is like what I was talking about earlier, where you can still get those services, but you may still have to pay for more, depending on how much you have and how much money you can make. Non-elective services providing in the inpatient or outpatient settings include behavioral health and non-elective procedures. This policy applies applies to both Columbia St. Mary's Hospital and integrated physician billing. This policy does not apply to the payment arrangements or elective procedures as determined by a licensed physician, including but not limited to cosmetic procedures. This policy may apply to international patients on a case-by-case basis. Eligible for their charity care program, the patient must have or will receive medically necessary services at a Freighter health entity. Have cooperated with the respective hospital in seeking out and applying for other potentially available financial assistance programs, and have exhausted any or all insurance and other available financial assistance programs such as Medicaid or Badger Care, and lack the financial resources to pay for services rendered at the Freighter health entity. Alright, and similar to all the other hospitals, they only care for medical necessary services. So, and then care with obligation or discounted obligation to pay for services. So, as you can see, all the hospitals have pretty similar umbrella of only medically necessary services that we provide prescription from what I've received as information from the hospital themselves.
Either they have an outstanding, like being in a relationship, they usually have an outstanding bill that has not been collection. So whether they acquire that bill through an emergency visit or whether they acquire that bill through paying the $300 to see a physician at a clinic uninsured, those are the ways that you become to have a relationship with a provider in their definition. 1916.
So
Yeah.
this has been going on for a while that you can get.
Yeah.
Okay. And what about like not life-threatening, but kind of sort of like hip replacements, knee replacements, colonoscopies?
They didn't have specifications, sorry.
Okay.
So I can't answer for the hospitals on everything. It's because I don't want to say something and be wrong.
I'm just thinking of some of my clients that,
Yeah,
you know,
like if somebody who
chronic
needs
ENT problems, you
Yeah.
know, that's not like, they're probably not going to die of it, but
it's hindering their
well,
ability to live.
yeah,
though.
right.
You know, if they've gone to the emergency department and the physician there has seen them and was like, this is fairly urgent.
Okay.
They get them the charity care and then
But fairly urgent.
fairly
is
urgent.
the-
I mean, they're
okay.
not going to do a procedure that is going to cost $100,000.
Oh,
and
right.
They're not going to die, you know.
Right.
Somebody should have their gallbladder removed or something. They just can't because
If it's not
life and
medically
death.
necessary at that point.
That's where the wording gets difficult for us to understand, and it kind of goes to where you might just have to call them and ask, because it's only so much that you will get told, and it's only so
Right.
much that we'll know to be able to tell you all. Because it's just the way they term things may make it sound like, okay, this to us is medically necessary, but to them it's not. So
sure.
it also depends on the hospital and what they're having questions later on. You can possibly call Megan or email myself, and we can look into finding the answers for you. Through this process, I've gotten a lot of numbers of people that I probably wouldn't normally have gotten. So.
Find out ahead of time how much, say they have to go for a colonoscopy or something, how much that's going to end up costing them ahead of time, and then can they deny it if it's just too much? Or, I mean, does that ever happen when the patient's like, forget it, I can't pay it? Or
When a patient has charity care, after they've been approved, the hospital systems are all different. It varies from a 30-day processing time into like a 60, 90-day processing time to process your charity care application before anything is ever covered. So once that processing time has come, they found you to be eligible, your patient gets a letter in the mail, and it'll say, you know, this so-and-so is covered for 100% of coverage for charity care. Usually the times are about 6 months that they have that coverage. So it'll be 100% if it's medically necessary.
Okay.
And that's the key.
Does it list the things that it covers then?
No.
Not necessarily?
No. So you need to, the patient has to really advocate for themselves.
And
I had a patient a few months ago who was a patient at Columbia St. Mary's, and their pathology is separate. So charity care doesn't cover pathology because it's a private service doing that. So charity care doesn't cover that. But I called the pathology service myself and I asked, you know, is there any way we can financially work with this person? And they do honor Columbia St. Mary's charity care. But it took a matter of me calling to get this all kind of figured out. They're not just going to automatically give it to the patient. So that's also a big problem because patients, yeah, this service will be covered, but then say an anesthesiologist is private, then they'll have that bill if the anesthesiologist does not uphold the charity care, which they're not. They don't have to because they're private. They're not employed by the hospital. So out there that don't come to a social worker like me, and they just are like, well, I'm just going to go to collections, it's going to be a lost cause, whatever. And those are the people we're trying to prevent from doing that, to say, hey, these are the resources that you have available to you. It is hard because, as Brianna, you found out, every hospital system you called, you get different answers. There's not a blanket policy, which I definitely understand that there's not because they're all so unique in their own way. But as a patient, as an advocate for patients, it's very hard to work with patients that have charity care or anything with the hospital systems because everything is so different and it's really on a case-by-case basis. So it's just so important if you find that your patient has charity care, whatever, that you contact us or you advocate for your patient to call the hospital system that they have the charity care with and work with a financial counselor to figure out how this covers.
Thank you all for coming today.
If you get home or get back to work and think of another question, just email us and it's the answers for you.